afternoon, everyone, and welcome to today's session on Universal Health Coverage Day. This is an initiative by Voice of Healthcare, and our topic for today is a crucial one: the price of motherhood, making maternity care affordable in rural India. I'm your host, Subhangi, and I'm delighted to be guiding this important conversation. India celebrates motherhood like no other country. Our nation, our rivers, even the earth itself, we all honor it as our mothers. Yet, for our countless rural women, daily life tells another story, especially when it comes to affording or accessing quality maternal care. For understanding this better, we have Dr. Rashmi Ardey with us, who is the Director Program Health of the Smile Foundation. Dr. Ardey brings over 30 years of experience in public health, focusing on maternal, reproductive, and women's health. Thank you so much, ma'am, for joining us today.
It's a pleasure. Thank you. And I'm very happy to be lending my voice to this very, very important and crucial topic. Thank you for having me.
It is indeed a privilege to have you here today. So, to start with, as we have often heard this phrase, "Jaan hai to jahan hai," meaning nothing matters more than safeguarding your health. But with the cost of medicines and essential diagnostics rising, a lot of rural Indian families don't really get to live by this belief anymore. For many, pregnancy itself becomes a battle for survival. From your expert perspective, how are rising healthcare costs reshaping maternal health access in rural India?
Yeah, that's a very important question. Jaan hai to jahan hai, par pehle jaan to ho. So very often, unfortunately, right now, uh, it is less, and I find a lot of women are now debating not between various healthcare options, which is what it should be, but whether or not to seek healthcare. So I think that is never a choice anybody should have to make. And what is happening was when you're having to choose between khana khaye, they should have a good diet, a nutritious diet is required in pregnancy, or an ANC checkup. Very often it is the health visit, an ANC checkup which gets neglected. Very often it is the diagnosis tests which get pushed into the background that these are not required at all. Right? Another thing that is also a difficulty is simply accessing healthcare. It's not available at home. You have to go a certain distance, which means there's a loss of daily wages. So all these factors play such an important role, which should never be the case, especially not for such a crucial part of life as maternal health care, right? At this point of time, the only thing that should be important is the quality of healthcare. And unfortunately, many of our rural women do not have that choice. So, but what we really need to do for this is there are various ways that it can be worked with. And I think I'm happy to say we are at Smile Foundation, we're trying to do some of these things. I talked about the problem of accessing healthcare. You have to go visit a healthcare facility, right? Also, this is India. Very often somebody else also has to accompany you. This loss both travel as well as missing daily wages. What is can be useful at this point is having a mobile medical unit, for instance, right? A healthcare which comes to your doorstep. And if at that doorstep, if you also have something like point of care tests, right? Let's use technology, point of care tests, telemedicines, all these factors will help in making at least regular accessible at their doorstep. So see how much easier it is for women, especially rural women in hard to reach areas, to access healthcare that is right there. They do not have to no costs and all. Also, these are free. Now, this is free even in public health facilities. The issue is sometimes it's not available. And that is a perception a lot of women. Sometimes it's perception, sometimes it's true. And what we need to ensure is there is uninterrupted availability of drugs, of medicines, of diagnostics at the healthcare facilities. If all of these we can ensure, I think it could go a long way in ensuring all the women in India, especially in rural areas, in underserved areas, vulnerable women are able to receive the care that they should be getting at this point of time.
And that was indeed very insightful. You talked about mobile healthcare units and public health services. But often in many villages, which are remote, but still there are low cost or free doctors are available there, families often avoid seeking care, especially if there is a male doctor. Like when we're talking about gynecology, like there's a lot of stigma around it. During
Right.
complicated pregnancy, this often ends in being fatal for the women. Do you think this kind of a stigma limits of affordable maternal health care?
Unfortunately, yes. In a country like ours, where socio-cultural norms and traditions still have a major role to play, where family is still a strong voice, there are always situations when a woman is just not comfortable going to a male healthcare provider. Right. And again, I am going to repeat, telemedicine can play a big role because this is not a systemic issue, right? It's not that there is no healthcare facilities available. The question is women, they're not acceptable. See, that's one of the basic pillars of quality in healthcare as defined by WHO, right? Healthcare should be acceptable. So, how do we make it acceptable? We can't change society. It's not going to happen suddenly. We have to make our modify healthcare delivery in such a way that they are acceptable to the women. So we can do that by strengthening the capacity of our frontline providers, having more female providers, right? Also, strengthening their ability to identify these high risk pregnancies or danger signs so that women are referred to a higher facility, and also a lot of social community engagement. And at such times, it doesn't, the gender of the provider doesn't matter. But that's going to take a long time. What we need to do is immediately more female providers, strengthen the capacity of frontline workers, have more midline providers like midwives and who are trained to carry out ANC care as well as basic delivery services. I think that's the way to go at the moment.
But ma'am, yes, educating more amount of female providers is crucial. I believe that. But while researching on this, I came to know that in many remote villages, there is a scarcity of doctors, and I don't know if this is a like fact to be happy about or sad about, I don't know, but this is a true fact that most of the providers happen to be male. And there are families, maybe the woman is at a dying condition. At that point also, they prioritize their stigma over their welfare and well-being. They would be like, no, that's a male doctor, how can he treat you, right? So that's a lot of stigma, I believe, where you are prioritizing the health of your wife or your daughter, or like not even considering that they might die. So, talking about it, there are many government schemes that are related to educating, maybe the daimas and anganwadis. Uh, then there are a lot of schemes to help this rural women as well, like Janani Suraksha Yojana and all. But many women still struggle to access these benefits because maybe illiteracy or they do not have digital access. Do you think this kind of issues continue to block women from receiving what is truly meant for them? Like they're unaware of the schemes and all.
There are a number of them, Janani Suraksha Yojana, Matra Sheshu Suraksha Karikram. There is also the government has a facility of 108, right? You just call up 108 and an ambulance will come. Unfortunately, what you said is right. Lack of awareness, right? Lack of awareness. How do you access them? Even if they know the schemes are there, how do you access them at all? What is the process required? Also, I mean, it's required for any schemes, you have to have a certain amount of documentation. You need to have an Aadhaar card, you need to have a bank account. Nowadays, you even need an Ayushman card. So, a lot of times, and even to get those cards, sometimes you need an online submission. You even need an OTP sometimes. That is going to out of rural women. Right. I mean, we do have excellent digital penetration, but it's not uniform across genders. So, to ensure that this is taken care of and this how this issue can be addressed, Of course, ashas and frontline workers have to be strengthened. There is no two ways, because you're right. There is a shortage of doctors, especially where they're most required. So there are a lot of new medical colleges being set up, but there are no facilities. So a lot of doctors are not really prioritizing going to rural villages. So which means whoever is available, a midline provider, their capacity has to be strengthened. Make women more aware about these government schemes where they can reach a good healthcare facility which has a female provider and other facilities, right? What we can also do is make it easy for them to get these facilities. And in fact, even at Smile, what we are doing is at some places we are being given that kind of authorization. So we facilitate people to obtain these Ayushman and Abha cards, and also tell them about the all the facilities available, how you can link them, right? Because you have to link, not only tell them, you tell them where is it available, what are the timings. For example, 9th of every month is a antenatal care day. So if you tell women that this is one day when you go, you will have all diagnostics available, you'll have ultrasound available, and have a specialist coming. Please go on that day. Also facilitate getting their cards. So I think it's just a matter of the schemes are there, the facilities are there. How do you link them? And I think this is also where some other NGOs also can be authorized to facilitate people and help them access these schemes, get these Ayushman cards and the required documents to get those schemes.
So, spreading the right information and education is a major part of it, a major
Always,
part of the
always,
job.
always.
That's
Awareness is the biggest thing. Awareness and lack of
because
awareness.
they're not even knowing what is truly meant for them. They don't even know the services or schemes. They're like, I don't know. That's very unfortunate actually. So I'm sure this will influence a lot of people in their interpretation of maternal health, and
Absolutely.
yeah, and they should be more aware, I believe. But uh, talking about affordability again, the cost of maternity does not end with the delivery, right? Postpartum care often brings in new expenses, be it infections or diseases like anemia, which can make recovery even costlier. In your opinion, does postpartum affordability get overlooked in the broader maternal health conversation? And how can schemes and programs evolve to properly include the aftermath of delivery?
Unfortunately, it is so true. I mean, once the baby is born, the entire attention moves. It's not the baby which is most important.
Yeah.
And the mother is only given that nutritious diet, all those supplements, only as long as she's pregnant. And there are lots of myths and misconceptions about this also, that lactating mother who's breastfeeding should not get certain foods, should not do this. There are a number of restrictions placed, so that also makes it more difficult. So the government has recognized that yes, postnatal care is important. That awareness is still not come down to the family. There are also ashas and Anganwadi workers. It's part of their mandate to visit, have conduct home visits on mothers who have recently delivered, to ensure that they are well, there is no infection, they are getting the right diet, they're able to breastfeed properly. But it's also a fact that our ashas, our Anganwadi workers, our frontline workers, they have so much to do. I mean, they are the backbone of the country's health system, but they're so burdened. I feel so bad. I mean, when I see them, but they are doing a lot, but there's still a lot more that we need to do.
They are
Again,
where the yeah they
they
are
are
where the doctors
absolutely
aren't,
like,
right?
they are awesome. I mean, I can't even come up with words to express my admiration. But there is a limit to how much they can do. And I think this is again one of those things where a public private partnership, after all, we have to work together. We all have the same goal. Let's make it easier. Let's improve the health condition of our mothers. And if we can all work together, some kind of systems where a private organization or a healthcare network can take over this routine home visits, monitor the young mothers, carry out the postnatal care. I think it'll go a long way. And also, this will also help the women and the family members become more aware that this is such an important thing. And I think what also has been is not really recognized as postpartum depression. that is not really being recognized. But now, yes, there is more awareness, at least in the urban areas, but in the rural areas, it's still not recognized. We still not acknowledge that a mother would feel so overwhelmed in the early days. I think there's a lot of support that she also needs, which our frontline workers are doing, but there is so much more that can be done.
Yes, ma'am. Like again, a lack of awareness, that's a
Absolutely.
major part of it. Like
It's
there is
just
so much more to pregnancy than just delivery, right? Like,
so
the
true.
screens and everything, like, the postpartum depression that you're talking about. Unfortunately, in many households, they blame for having depression from delivering the
Yeah,
baby. Like, you're
yeah.
blaming the women. So that's just, yeah,
Because she's supposed to be overflowing with the milk of human kindness, but
yeah.
it's too much. She's just a young mother, first time had a baby. She doesn't know what all she's supposed to do. Somebody has to guide her, somebody has to support her. She needs rest. Maybe anemic. She may be just tired. She also still needs to continue with her supplements, food supplements. She still needs a good diet. She needs rest. All these things. It's just like you said, it's just awareness. If we can do that, there's a lot being done. And I think programs like yours hopefully will go a long way in people more aware of what is required for good quality maternal care.
I think blaming the woman is also a part of the social hierarchy that we believe here in India. That a woman is only good for delivering the baby, of no use. Then why should we take care of her? So,
Well, she has to breastfeed, doesn't she?
yeah, 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 yeah. Keep the baby alive. Yeah.
Keep the baby healthy.
So, another critical phase of maternity is labor, where every minute matters, right? So, for low income families, high ambulance charges make emergency transport nearly impossible. How do you see mobile healthcare units? As you talked about, that mobile healthcare units are there, but are they truly accessible to the remotest corners of India? Like when they are needed, like maybe a village in middle of nowhere where there is no medical assistance at all. Can they reach there?
Uh, See, I am not going to this thing. Yes, the penetration is far more than the static clinics or the mortar clinics. Definitely, mobile medical units will go further. But if you're talking about active labor, that's not a time a mobile medical unit can be of much use. What they can be helpful is identifying cases of high risk pregnancy, regular continuous follow up, because sometimes what happens is, and especially in rural areas where women don't really prioritize regular antenatal care, a mobile medical unit, for example, our units visit every location in their area at least twice a month, which is better than a woman going to a healthcare facility once every 3 months or 2 months, right? So if there's somebody coming to you, maybe they'll identify, no, your blood pressure is going up, or you're looking more anemic, please get yourself tested, or at least send them to the health facility in time. Maybe even talk to the family members that no, this is an issue. Another thing, again, we talked about 108. There is a government free ambulance service available. The issue is a lot of women either don't know that they have a right to it. It is the right for every woman. The government has made that service available. But if women don't know, don't use, how do they do it? But again, Ashas here, because Ashas are responsible for and they have a roster. They go to every person, every pregnant woman, they go, they facilitate, and which is why now institutional delivery has gone up. But the question again is identifying that they have to build healthcare facility in time, and this decision making. See, the delay in decision making, that can be sometimes have adverse outcomes, and it's not just for the mother, it's also for the child. So it's all about awareness and what we call birth preparedness. Sometimes it's not about the actual care. So all of what our mobile medical unit can also do, speak to the woman and her family, counsel them about birth preparedness. What do you need to do? Rather than having to think about it when the labor pains start. think about it. Where will we go? How will we go? Who will accompany the woman? What are the documents that need to be taken? If this is all
Pre-planning is
prepared,
important. Yeah.
pre-planning, awareness and pre-planning. So if all
Yes.
that is thought about, then they're also told when should you go? What are the signs of labor? You don't have to wait till it's absolutely like the last
Yes.
crucial stage. Go in time. So all this is a part of birth preparedness, which also mobile medical units are doing. There is
So,
mobile
ma'am,
medical
yeah.
units and other, for example, we also have Pink Smile, which is for women's reproductive health.
Yes.
So they
Yes.
focus on birth preparedness, really speaking with the woman and the family.
So, suppose there's a family where the woman is at a stage where they need to be taken to a medical facility, and then the family is thinking of going to a hospital or something. There exists this hesitation that private facilities are more reliable for families, obviously, who can try and afford them. So they end up taking a huge loan, or maybe they would just sell their everything to make sure that the woman gets the private facilities. In your perspective, what does this say about our Indian public or the government healthcare system? Why do you think there is a lack of trust?
I think it is more about perception of quality rather than quality itself. Because our public health facilities are free, everything there is free, they're also overcrowded. And a lot of our public providers are not able to concentrate on some of those public facing aspects of healthcare. Communication. Explain to the patients what is required. Why are they doing it? Right? So, because there is lack of that communication, they're not really able to engage with the patient. They don't have the time sometimes. Sometimes it's not that they don't want to, they're just too many people. They're all overloaded. So, that is what causes the gap. Another thing that can help is a lot of private facilities, they have the resources for keeping their environment also clean, having a nice friendly environment. It makes a difference to that perception of quality, right? Sometimes that does not feel this, that is some one aspect that is not given the kind of importance. It's not that they don't know it is important, they have to prioritize what are they looking for. So while the care itself is good, it is that perception that makes people prefer private healthcare. And you're right, people take out massive loans just so that they can do it in a private healthcare facility. I think what we need to do is, again, let's improve communication. A lot of us, even for us, I think we talked more about how to provide, how to healthcare, how to speak to a patient, how to reassure a woman who's in labor. The other thing, ठीक है, just spend 5 minutes extra, speak with her, reassure her. It's all a matter of effective communication and community engagement, trying to show that this is, yes, we're providing good quality care. I think that perception is all that really making that difference in the minds of people.
I think the perception has a stereotypical angle to it as well, because I personally have visited a government facility where I saw on the stairs of the government hospital a woman was, having like a syringe, like there were like nurses around her. She was put on saline and all. So they try, I think, but as you said, the overcrowding is a big issue at government hospitals, because as we know, it's affordable, much more affordable.
Exactly.
So, yeah. Thank you, ma'am. We'll be now moving on to our rapid fire round, and I'll be asking you some quick questions, and I'll
Okay.
expect you to answer them briefly. Okay. So,
Okay.
biggest misconception about pregnancy costs.
Expensive and not required, unfortunately, because it is very much required.
One memorable role model or story from your entire experience in maternal health that is still with you today.
Public domain, the Dr. Dang, the two. Dr. Bang, sorry, not Dr. Bang. This is in Gadchiroli in Maharashtra. What they have done for poor women and the newborn in that area is tremendous. Hats off to them. In private, I think I have visited some private primary healthcare centers, which are so beautifully equipped, and the women there, they've been. There's one nurse who's been there for I think for 21 years. I just literally there are generations who come and touch her feet because she's birthed all of them, and she was still so patient, so kind. I was happened to be there when that one woman was brought in. Can't forget. The very presence was a reassurance. And I think that is something that we all need to aspire to.
Okay, thank you, ma'am. One key skill Anganwadi workers and midwives need to master first of every other education and awareness that need to get, the first skill that they need to have.
Identifying danger signs and signs of a high risk pregnancy.
Right. Importance of responsible male involvement in maternal health.
Unfortunately, there's still a major aspect of decision makers. So unless and until you involve them, it won't really work. But when they are involved, they get better nutrition. They will ensure that their wives or partners will come regularly. There's more financial resources available. So yes, very, very important.
Thank you, ma'am. When a safe pregnancy becomes a privilege instead of a basic right, the cost is paid not just in money but in lives. Talking about India, where we celebrate motherhood the most, as we spoke about in the beginning, do you, as someone who has not only worked in maternal care but also is a woman herself, feel India is doing enough to make her mothers and daughters perceive maternity as a boon and not a hassle or a struggle?
What is enough? There is no question. What is enough? We are doing a lot. I would first and foremost very there is the government who is doing a lot. There are a lot of non-government development organizations who are doing a lot. But like I said, there's still a long way to go. And unfortunately, as long as a woman's income or her geographical location or somebody else's opinion decides whether or not she goes in for maternal health care, I think our work still. We have a long way to go.
Yes, we do have a long way to
Otherwise,
go.
yes, what we have to realize is, you know, investing in maternal health care is investing in our country's future. That's where it begins. I think if we keep that front and center, this is our future. Mm, That's why it's important.
Thank you so much, ma'am. I'm sure your valuable insights and practical advice taught us a lot today. Thank you so much. It is such a privilege to have you here with us today.
Thank you. Thank you for having me. Thank you for giving me this opportunity, and it's been a pleasure speaking with you.
Thank you,
And I
ma'am.
would like to tell all our viewers, please respect and give a little support to every mother that you see. She's carrying the future of the country. Thank you so
And
much.
to our audience, as we reflect on the challenges and opportunities in making maternity care affordable, let us remember that supporting mothers is not just a health issue, but a step towards a stronger and healthier India. Thank you all for being a part of this important conversation.
Thank you. Thank you, everyone.